Welcome to Stem Cell Activators with Dr. Joseph Christiano. Dr. Joe is a naturopathic doctor with over 45 years of experience in natural health. Listen and discover how stem cell activators are helping people enjoy a greater quality of life.
Hi, I'm Dr. Joe Christiano, and welcome to my show. I'm so glad you tuned in. Listen, all my shows, like today, we're going to be delving into the root cause of illnesses and disease. You know, you're probably sitting there and maybe have an illness of your own or a condition that you've been dealing with, it seems like forever. And typically, if you're like me and everyone else, we kind of deal with our issues and our health as long as we can before we see the doctor, because who wants to see a doctor, right? Well, anyway, when you see the doctor, you share your complaints, typically your symptoms. And we go the conventional route after maybe a test or two, x-ray, some films, blood work and things like that. You sit down with them and discuss where you're at, what you're dealing with, what condition you have, and then your written prescriptions for medication. And that's how you follow the path to healing yourself. With one problem: medications are not designed, they're not formulated to heal the body. The body has been designed to heal itself. If you're on medications, and I understand it, this is the protocol, this is conventional medicine, and we get on medications to feel better, to get better. But in reality, the best medication can do is manage your symptoms. Those symptoms that you're dealing with, whether it's pain, whether it's elevated blood pressure, whether it's your A1C with sugar and dealing with diabetes and things like that, those aren't the problems. Those are symptoms of a root cause. That's why all my shows are designed around stem cell activators and what the activators do, because we want to go to the root cause. When we go to the root cause, by the way, we are going to eradicate the cause or the problem, and hopefully over time, based on your condition, one by one, all the symptoms that you're dealing with dissipate, or at least that's the goal, so that two things happen. One, you enjoy a better quality of life, you feel better, the pain is gone, the kidneys are functioning better, you breathe better, whatever the case may be, but also you're reducing the toxicity that's built up in your body from taking medications. Listen, as a naturopathic physician, my goal is to get you as healthy as possible so you don't have to go see the doctor. I know it's crazy, but the truth is we've been created in a fashion that the body will heal and repair its own tissue. But over time, based on your lifestyle and your maybe inherited conditions, you're dealing with these varieties of conditions that are taking you out of balance, out of homeostasis or a balance. And consequently, you have to go to the doctor and get your meds. Well, the meds are contributing to building toxicity in the body. So here you are wanting to be healthier, you want to heal, you want to feel better, but what's happening is you're actually building toxicity in the body. And when the body is toxic, it can't heal, or it's going to greatly slow down the healing process. That's why as a lifestyle, I'm always talking about detoxifying the body, whether it's a colon cleanse, a liver cleanse, or whatever. And these are things I'll talk about in other shows, but it's getting the body back to normal function so it can do what it's designed to do, and that's heal itself. And that's where the stem cell activators come into play. And we'll talk about that in a minute, because I'm going to do some Q&A, by the way, and answer some questions that come into my office so that it'll give you a little more information, more insights on what to do if you get banged up. But there's something I want you to think about. It's really an attitude. It's a mindset. And what I want you to do is take ownership of your health. Take ownership of your health. Now you sit back and think about the day in which we live in today. You don't have to look far and you can see what's going on. Whether it's coronavirus, whether it's bacteria, whether it's fungus, whether it's flu, whatever we're dealing with, it's around us, and it seems to be getting worse. And if you and I don't take ownership of our health, I mean take ownership of it, nobody is going to do it for us. That's why my whole life, personally, dealing with my own personal issues, with which one has been chronic pain. I've let people know this all the time. I've had chronic pain since I was 18 years old, and believe me, a life of pain is not fun. That is one of the reasons that's prompted me to go out and do the research so that I can help myself, but I can help people like you, because we're looking for answers. Man, you've been going to the doctor for 15 years. You're on blood pressure medicine for 15 years. You're taking cholesterol medicine for 15 years. You're taking sugar diabetes medication. And I say, get off the medication and see where your numbers are. And you say, well, it's helping to stabilize my condition. No, it's not. It's stabilizing the symptoms, but it's doing nothing for your condition. Because if you got off the blood pressure medicine, I'll guarantee it'll be elevated, because 75 different medications for blood pressure only tells me nobody really knows the cause. Why would there be 75 different types of blood pressure medicine for blood pressure? Okay, and typically, here's how it goes. Well, let's try this and see how you do. And then it's like, well, if it doesn't work, we'll try another one. And if that doesn't work, we'll try another one. Well, it's kind of like a coin toss. And that's not what we want. What we want to do is be more specific. And that's where the stem cell activators come into play, because they are designed, in fact, 27 different ones are designed to target 27 different areas in the body. Today's show, we're going to be talking about the central nervous system and the brain, and all the related concerns later in the show with my wife, Lori. But here, I want to let you know that there's 27 different activators, so even if you're not dealing with neuropathy or central nervous conditions, you may be dealing with heart, lungs, kidneys, diabetes, something else. So that's the benefit of knowing more, having more knowledge, so that you can get the answers to the questions that you're not getting so far. But what I want to do today is maybe read a couple questions and get you a little more informed about how these stem cell activators work, and some of the ins and outs, because we're going to talk about it later in the show, as well as you'll hear some testimonials of people, real people. I always say that, you know, real people with real results. But if you can keep in mind when you watch my shows to take ownership of your health, that's going to get you through the rough times. And believe me, no matter how hard we work at this, listen, for all my life, I've been working at keeping this body in shape. And I'm in pretty good shape, but at this stage of the game, at over 70 years old, I'm working at keeping the seams together. But I still deal with chronic pain. I've had surgeries, and believe me, if you haven't had a surgery, let me tell you something, that should be the last choice, the last option you make. And the reason why, once they cut you open and they seal you back up, you'll never be the same. Now, you may got rid of that issue that you're dealing with, but the body doesn't heal the same. And you'll be dealing with the fallout. I call it the fallout from surgery. So we want to do all we can, make all the wise choices we can, natural choices we can, before we get to that level, before our condition gets that bad. But let me talk a little bit about, or answer a few questions about stem cell activators, so you get a little better picture of what they're about. I get them all the time, and so let me just look at a couple here and see what we can. Okay, stem cell activators. Oh, by the way, here's a typical bottle of stem cell activators. They come like this here, and I'll point this out later too for you. But they want to know, do they need to be refrigerated? Do they need to be refrigerated? Absolutely not. In fact, there's another question that goes along with that we're asked all the time. I live in Canada, you know, or I live out north. I live in Colorado, and what happens if they freeze when they're mailed to us? Or those down in Florida or in the Caribbean that order them and they sit out in the heat, will they destroy, will they lose their potency? And the question is absolutely not. They will not lose their potency. There's no shelf life. These are amino acids that are plant-based. So not only are they natural and targeted, but they have nanotechnology that's added to it. And the nanotechnology makes them more efficacious, more effective, more powerful, but they're harmless. There is no side effects. They don't interfere with medication. They don't interfere with your supplementation if you're taking nutrition. And so they work hand in hand with the protocol maybe that your physician has you on right now. When you get them shipped to your home, you'll get the instructions on how to take them. And typically it's just putting drops, up to 20 drops a day into about 2 or 3 ounces of water. It's very simple on an empty stomach. A lot of times I'll suggest to people, first thing in the morning, before you eat anything, take your stem cell activators. And by the way, you can take up to about 4 different activators. So if you have 4 conditions going on, you can treat all of them naturally at home. But just make sure when you take them that you give yourself about 20 to 30 minutes, at least 20 minutes, before and after eating or drinking something. This way the activation will take place and take a good foothold. People also ask me this here. They'll say, how long do I have to take them? You know, or do I have to take them for the rest of my life? And it's pretty much a unique answer because the body is designed to heal itself. And these stem cell activators are not designed to heal, to correct, or to cure your body. But what they do is they help your body do what it was designed to do, and that's heal itself. So if your body is not healing, if you're living with a chronic condition, the stem cell activators are the way to go because they will help turn on, so to speak, to rejuvenate your stem cells that heal the body. Before I get into the segment with my wife Lori and I talking about the central nervous system, let me open up a little bit of the topic of stem cells. We'll say stem cells 101, so you get a better idea how they work. Your stem cells, our adult stem cells, not embryonic, they work in a way that when you have a trauma, when you're sick or you have an illness or a degenerative illness, maybe liver, kidney, lungs, it doesn't matter. Your stem cells release in the body and they go to that area and they become that tissue to heal those tissues. That's what they do, and it's part of our genetic makeup. It's absolutely amazing. And so when you have this trauma, whether it's an accident, a broken bone, or sickness, these stem cells rush into that area and start healing the body. That's why we recover. But over time, the aging process, environmental toxins, pollutants, and an array of other elements in our life, lifestyle, stress, things like that, causes our stem cells over time not to function properly or optimally. And so you and I start to experience this nagging condition or chronic condition, which the body, like we talked about, is sending up all these symptoms. It's saying, listen, something's wrong down here, help us out, you know. We medicate, but we don't want to medicate, we want to go put the fire out. And so the stem cell activators are the ticket for helping your stem cells to come back to normal function and hopefully optimum function. And by doing that, then they do their job. And their job is to heal the damaged tissue or cells in the various areas of the body, whether it's bone, whether it's blood, whether it's organ, it doesn't matter. That's what your stem cells do. And once you start taking the stem cell activators, and for everybody, the time to take them is going to be different because the activation occurs the minute you start taking the activators. But you may not feel anything or experience anything for weeks or maybe a few months. Some people, in weeks, they notice something different, and some people not till later. And it's basically because each of us are unique and different, and it's the way our body responds. But with the idea of understanding stem cells and how they operate, and now the stem cell activator going to the root cause to rejuvenate those stem cells, you have a better chance of healing yourself. Now let's cut away and hear what Lori and I have to say about the central nervous system. Hey, this is Dr. Joe Christiano and my sidekick and wife, Lori.
Hi.
Hey, listen, we're talking today about stem cell activator CNSE, and it has to do with the central nervous system in the brain and the eyes. Yes. And it covers a multitude of conditions that are associated with Lori's probably going to share with you later. But I want to keep one thing in mind is that is so important when we're dealing with nerve-based issues or root issues, is that when there's nerve damage, whether it's in the central nervous system, if it's peripheral or if it's local, the nerve that gets damaged, if it's not corrected, then it could become permanent nerve damage. And that, my friend, is something you want to avoid. But hopefully what we'll learn today in this video will help you have a little better understanding of what you may have to do or would like to do should you or someone in your family or someone you know have issues that are related to this. But I think maybe a good place to start, Lori, would be sharing some of the possible applications that this particular stem cell activator does.
And the good thing about these activators, they're all natural. They are all from plants. There's no negative side effects to taking them with medications or supplements or anything, and they're really easy to take. So Dr. Joe will be showing you how to take them. But the possible applications for, it's called CNSE, Central Nervous System for Eyes and Brain. And that helps with regulate intracellular communication and support cellular and tissue regeneration in the central nervous system of the brain. And it helps support cognitive and neurological function and stimulates efficiency of the central nervous system. So the possible applications would be strokes, dementia, depression, anxiety, psychiatric, anything that would be an overstrain of the central nervous system of the brain, weariness of the eyes, which we'll talk about different eye conditions that it has helped, and much more. And so it's all about the eyes and the brain, everything up here. And we've helped a lot of people with so many different issues with that.
I think you mentioned possible Parkinson's, condition with Parkinson's.
Yeah, Parkinson's. And,
yes. I'm not an expert in Parkinson's, but I've done enough study and research to try to determine what's the cause, and many of the experts aren't always sure what the cause is. But one thing is for sure is that there's a neurological problem, with Parkinson's, which then there's a domino effect of symptoms like tremors, and there's a condition where the person ends up moving in slow motion, and sometimes they seize up and things like that. And these are coming from the central nervous system. So again, when we're talking about the root cause, or we are talking about the root cause instead of the symptom tells us what's going on, but let's not treat the symptom. And because of the lack of information, even in the medical community, things like stem cells, stem cell therapy, PRP therapy, and even stem cell activation, though it's been around, it's relatively new in these communities. And a lot of doctors shy away from them because their schooling was such for their expertise. But I think the 21st century patient is becoming smarter. They want to do more research. They're going to get second and third opinions, because usually we get that death sentence. And it's after having months and months, maybe years of treatment and no progress, we get the final death sentence that says, there's nothing more we can do for you. Oh, wait a minute, what did you do for me up till now? Nothing. So the stem cell activators are really this cutting edge, futuristic natural means of going to the root cause. And so with Parkinson's, what I realized, because I was talking to a potential patient, and they started them. So they're going to report back to me to see how they do, because I can't make any promises, and we don't do that. We don't paint pie in the sky, say, well, if you take this, you're going to heal. But what we can do is tell you how they work, and from there, it's totally an independent thing. But we're finding some pretty good results going on.
Well, actually, with Parkinson's, we have had people with Parkinson's who've told us to stop their tremors. We've had a lady
See, that's huge. That's huge.
Well, I'll tell you my one story, not Parkinson's, but with Alzheimer's. This gentleman's wife ended up with full-blown Alzheimer's, and she just sits in a chair all day and never moves. So he goes, you know what, I'm just going to start giving it to her, having her drink it. She doesn't do it completely, with the mixing it in her mouth for a little bit. She just drinks it. She doesn't even know what she's taking.
She doesn't know?
No, she doesn't know.
Wow.
She's got Alzheimer's, so she doesn't know anybody when they walk in the door. She just sits there. She doesn't do anything. So he goes, I'm just going to have her drink it every morning. So first thing in the morning, he'd give it to her, and he called back, and he goes, okay, so now she's vacuuming the floor. She got up to vacuum, and he was so excited.
Wow.
So then he called back the second month, the second bottle. He goes, all right, so now she's recognizing people by name.
Really?
Okay, so now she's third bottle,
That's
she's
incredible.
now vacuuming and she's cleaning the house. She's doing more things. She went back to the doctor and she could put numbers on a clock on her fourth bottle. So it shows you how it progresses. One bottle isn't going to get her to put numbers on a clock, but that fourth bottle, it helped her get to there. So we don't know how long it takes for each person to get the results they're looking for, or it could take months, but we say start taking them. They don't interfere with medications, supplements, or anything. They're all natural, they're all plant-based. There's no reason not to take them.
Yeah, well, let me explain how they work so that it gives you a good idea. In this case, we're talking about nerve issue, nerve damage, and so on. But the stem cell activator really doesn't do the healing. It's not a nutritional supplement, by the way. It's a technology. And so it doesn't heal, it doesn't repair, it doesn't do anything but rejuvenate the stem cells in your body that are not functioning properly. See, your adult stem cells, they signal to one another, and we read that in the book, that they signal, it's called cellular signaling or communication. Well, when there's a disruption or a short circuit in the communicating element, then what happens is the cells can't do their job, and that is to heal the tissue. So what happens over a period of time, that condition not improving gets worse and becomes chronic. We can refer to it as a nagging condition. But neurologically speaking, like Parkinson's or Alzheimer's and things like that, the nerve issues are part of it, nerve damage, the neurons are being damaged. So the stem cell activator, it goes in there, and because it's targeted, it goes in and targets the stem cells that are in the neurons so that they can get back to par, in other words, to their level of normal function, so that they in turn can start healing the neurons or the nerve tissue and cells that have been damaged. When that occurs, these symptoms that these patients are experiencing start to dissipate. Now, if you have 5 or 6 symptoms, you may see elimination of 1 or 2 or 3. I would love to say they'll all go away in time, but the truth of the matter is that you've done whatever you can do up to this point, and unfortunately you're no better off. So just the reports that we do get, that Lori and the girls in the office get from patients with all types of conditions, are really near miraculous. I just want to give you the hope that there are options with these cutting-edge technologies that can really make a difference for you.
And we even had another daughter, called to place an order for the CNSE, that stands for Central Nervous System for Eyes and Brain. And she said her mom, she just wasn't thinking straight. She couldn't do what she used to do. So she goes, I'm going to start giving her the activators, And so she gave her the activators, and she was doing really good. Well, then she said, I don't think she needs the activators anymore. I don't think she needs it. So she didn't order the bottle again. So guess what? The mother did not know how to dress herself, or even that she needed to dress herself.
Wow.
So she couldn't think straight. She's not thinking as a normal thinking person.
Yes.
So the daughter called back and said, send me these activators for the brain, because my mom, I can tell a huge difference when she's not taking the activator. She doesn't even know what to do.
That would raise the question, well, do I have to take them for the rest of my life? And my answer to that is, only you can tell us that. In other words, just like a Parkinson's person or the Alzheimer's patient that Lori was sharing, it took 4 bottles to see the improvement to that level. Some people within 1 bottle, which is probably just less than a month's worth, are seeing improvement. But everybody's different. Your condition could be complex. There could be other underlying root causes, not just one. And so a good indicator is like this woman, when she stopped taking them, she lost her functionality. But once she started to rejuvenate those stem cells, she was getting her coordination, everything coming back. It's just a matter of being in tune to your own body and how your body's responding, and whether it's symptomatic where you can see and feel, or if it's having blood work, repeat blood work. These would be great ways to monitor your progress, and then you make the decision from there.
And then the other thing, that the specific activator, because they always cut, do you have anything for your eyes? Well, we say give it a try. This is our activator for the eyes and brain. And We've even had people who take the drops from the bottle, the little bottle, and put it directly in their eye. They do 1 drop twice a day. And we've helped people with macular degeneration.
Yes.
Actually, we didn't know if we could help glaucoma. We've helped glaucoma. We've helped cataracts. And we're like, just give it a try. There's
Crazy.
no negative
It's
side
absolutely
effects to
crazy.
taking them.
Yeah.
And
It's
even
crazy.
your cousin.
Yeah. Yes. She was having problems. She was getting shots, right?
Shots in her eye every month.
Imagine
with
shots in your eye.
Yeah.
And
with macular
with nothing
degeneration.
better, without hope of it improving. And then she starts taking the stem cell activators, and next thing you know, she doesn't need the shots. And her MAC is improving. The MAC degen is starting to get better.
And the good thing is she went to her doctor. She went to a doctor to
Yes.
find out if it's okay
Sure.
if I try these. And he
Sure.
goes, sure, why not? You know, if you want to try them, let's do it. And so he kept
Yep.
monitoring her, and I don't think she's had a shot for over 5 months.
You know, and that's amazing because, you know, you're following the protocol the physician gives you, and bless their hearts, they're doing what they know. But in conventional medicine, as you and I know, they treat just the symptoms. And that's where stem cell activation, even if it's stem cell therapy, but this technology and therapies are so cutting edge that they're disrupting the old norm. In other words, the old norm way of doing things is take some meds, maybe we cut, maybe we burn, and then we'll see how we do. And you never end up better.
No.
So these technologies, in particular these stem cell activators, are all natural, and they're doing something for the body that absolutely causes no side effects.
No negative
So if you're on meds and you're worrying about, you know, maybe an interruption or disruption of your medication, there is none. It doesn't cause any allergic reactions. And so it lines up well with your biology. And so it's just a matter of how long you take them to see results, and you go from there.
And the other thing is people with depression and anxiety.
Anxiety is a big
And people
one.
with psychiatric issues who just are so distraught they don't even know how to function mentally. Try them.
Yes.
This is the CNSE, the one for the eyes and brain.
Yeah.
Try them for any anxiety or depression, or if you feel like you're just not thinking straight. You know, you can't remember like you used to. Dementia, we won't use that word, but
Yeah,
it could be
sure.
just a loss of memory and you're
Yeah.
heading that way.
Yeah.
Well, stop it, you know, and don't give up.
Sure.
Don't ever stop trying
Right.
to make yourself healthy and feel better. So and depend on just doctors. Do your own medication
Yes.
through the stem cell activators. They're all natural, and so they're amazing.
And you know, when you think about where you are today and you're being treated or you're treating a condition, where are you further along? Are you better off than where you were? And if not, maybe this education that you're getting here and these technologies that are now available to you, that at least you know that there's other options that you can take advantage of, are at your fingertips. Go to the website, call our 800 number, ask for more information, or you can even order the products. But the key is being active. Do something about your condition, and the key to me is going to the root cause. If we can eradicate the root cause, you can start to see all these symptoms dissipate and start to enjoy a better quality of life.
If you would like to order our stem cell activators or Dr. Christiano's book, Stem Cell Revolution, please call 1-800-259-2639 or go to our website at bodyredesigning.com.